Thanks, Dakota. Really amazing insights and really important work. I appreciate it. All right, quick thank you to all of our presenters in this first session of our day. And I'm going to now open it up to our question and answer session. We have a few questions that have come in already, so I'll kick it off with those. Question number one, I think this is probably directed towards Josh and Dakota. If QR codes are used to share PII and PHI, how is security and privacy maintained? Is this at the cost of interoperability? And I will go ahead and ask the presenters, so Rebecca, Dakota, and Josh, to go ahead and turn your cameras on. Thank you. All right, so that question again, if QR codes are used to share PII and PHI, how is security and privacy maintained? Is this at the cost of interoperability?
So, I mean, one thing just to be clear, for solutions like the European Digital Green Certificate or for smart health cards, the QR codes do indeed include personally identifiable information. So they convey a vaccine result, and then what we look at is just enough identity information or just enough demographics to bind that vaccine record or the lab result back to somebody's identity in the real world. And so concretely what that means is they tend to include a first name, a last name, and a date of birth, those three attributes. So the idea is that the vaccine certificate or lab test certificate conveys the clinical information, and you can treat that as kind of a signed medical record that says, Josh Mandel, born on this date, had this vaccine. That package is generally presented as a QR, together with giving somebody a driver's license or a passport, some external form of ID. And so this is a really important point. The QR code doesn't serve as a form of identity. It just serves as a way to convey your vaccine status or your lab record, and you would use it together with another form of identity. So yes, there is PII. It's maintained securely in the sense that it stays with the individual, except when they choose to share it. And then when it's shared, they know exactly what's being shared. And the demographics are a set that's been designed to minimize the data that's disclosed while still meeting that use case of verifiable clinical information. And I can put a link into the chat that goes into an FAQ with more details, specifically from the smart health cards perspective. We try to explain this in the clearest language we can so that folks know exactly what's being shared.
Thanks, Josh. Dakota, anything to add there?
Sure. I think one of the this was a debate that was raised, with some frequency when we were in the process of developing the interoperability blueprint. There were some, and including some governments, who were incredibly concerned about privacy and set an incredibly high bar with regards to privacy, and we're very concerned about the use of the QR code. The risk that is something that an individual could take a photo of, and easily repurpose, and that simply there's sort of an artifact that is doesn't have some of the sort of privacy protections that we would hope. It's our perspective that it is an all digital solution to health passes is simply not an option when it comes to combating a public health crisis. That it's absolutely vital that we propose an approach that is inclusive, that's simple, and with that, we need paper credentials that are an option in a low resource setting, or for those who do not own or wish to use a mobile phone. And so with that, there was sort of extensive work on how do you ensure as many protections for privacy in the design of a paper-based certificate or in a QR code as possible. And I'm, like Josh, happy to put a link into the chat with some of the sort of the key technical work that went on. But I will say this is, as we sort of approach the publication of the interoperability blueprint, this was one of the places that I think people found stickiest, because there are inherent privacy concerns when it comes to use of a QR code.
Great, thanks to you both. Question number 2, is there a concern that these passports can be suspended or deactivated by the government to restrict movement? similar to how driver's licenses and travel passports can be suspended if someone fails to pay government fees, fines, or taxes.
Yeah, so I can give a quick answer from the perspective of smart health cards. There's a couple of related things that can happen. One thing that we don't provide for is issuers who want to revoke a specific credential. So like Josh hasn't paid his real estate taxes this year, we're going to revoke his COVID credential, his COVID vaccine credential. We don't provide a way to do that in the infrastructure. Once that credential is issued, it's mine. The signature can be verified forever, and it's up to a verifier to decide how long they want to trust it for. However, anytime you have this kind of verifiable credential infrastructure in a decentralized world, you do need to account for things that can legitimately go wrong. So, for example, an issuer needs to maintain its private signing keys in a secure environment. That's critical for the trust fabric of this whole infrastructure. And so one thing that could go wrong, just sort of by accident or by a security breach, would be an issuer losing control over its signing keys. And so what happens in that case is we provide a way for issuers to revoke those keys, to say they're no longer secure. We lost those keys. We're going to generate new keys, and then we're going to have to regenerate all our certificates again. So that's a major hassle, but it's something that an issuer can do in the case of a security breach. And I suppose it's a threat that a malicious issuer or an issuer that really wants to create chaos downstream could just declare that all of its signing keys have been compromised. The important thing to note there is that they couldn't target that attack at certain people. They would be basically saying every health card we ever issued is now invalid. And so that certainly raises the level of difficulty for issuers that wanted to play these kinds of games. But it's exactly right to think about these things in the threat model.
I think there are two other sort of scenarios that I would describe relating to this question of sort of who's an eligible issuer and how do you design the public key infrastructure in such a way to sort of minimize some of these threats. Or to maximize utility. So I think one scenario that we're watching play out right now is there's discussion around using the ICAO, which is the International Civil Aviation Authorities organization's public key directory as the means of verifying the sort of authenticity of one of these credentials for the purposes of international travel. And the thing about the ICAO PKD is that there's a very, very limited set of organizations who basically have access to it. So if you're a border authority, you're able to verify something against that ICAO PKD. It's being used for passports at the moment. But the airlines, for example, don't have access to it. And so it's been a real source of concern because the airlines have been asked to play a critical role when it comes to helping to verify that somebody has been vaccinated or has been tested, meets the entry requirements for the country that they're going to. And if you design basically a public key infrastructure that doesn't allow the verifiers access to it, the system doesn't particularly work. And so this has been sort of one of the key questions around how do you ensure that those verifiers who are meant to be using using these health passes are the ones who are in a position to actually verify using the sort of public key infrastructure that's out there. So that's one thing. I mean, just the extent to which we do have a public key infrastructure that's scalable and allows a range of potential issuers and verifiers. And I think that's presenting it only in the context of international travel. But as we're seeing right now, and I think particularly with the rise of the Delta variant, increasing use of health passes for domestic use cases, the range of potential issuers and verifiers is expanding almost infinitely. And so with that, how do we think about what an issuer or verifier registry that is flexible enough to permit, huge numbers of potential issuers or verifiers. So that's one thing. I think to Josh's point around somebody just revoking their keys. What I think is quite interesting is, the European Union with the digital COVID certificate has been wrestling, I think, with exactly this question, where they said, we are doing this only in the context of a public health emergency. And we don't want these certificates to have any life beyond the date that the pandemic is declared over. And so with that, they've designed very intentionally an approach to the public key infrastructure where they say, we're just going to sort of rip the cord at some point. And that is I think it's a really interesting sort of philosophical choice, and perhaps quite different than what we've seen others driving towards, which is saying, how do we ensure that at the end of the day, an individual is the one, sort of choosing how and when they want to use one of these certificates and the horizon for which they want it to be useful.
Great, thank you. Our next question is for Rebecca. Rebecca, as owners of immunization registries, what are we hearing from health departments regarding verifiable credentials?
And it is really, quite frankly, an honest and excellent question. I think one of the things that we have been watching over the years is we really want to give access to the people that quite frankly, it's their data. So we often have dubbed it the consumer access piece. And so there are a number of jurisdictions that have provided access to consumers over the years. And now we're really seeing that increased demand for this information. I think one thing that is particularly troubling is that, since December of last year, the concept of a vaccine passport has sort of taken on a whole new life. And that new life is very public and it's very political. And so what we're seeing is sort of the mixing of the product or how this is done with the policy. And as a result, we've seen a lot of legislative attempts, or in some cases, some actual legislation that are now restricting a jurisdiction's ability to sort of move into the new era of creating digital vaccine credentials for consumers. And so I think that's a really worrisome thing for us. I would liken it to keeping everybody with, you're going to only ever use pen and paper to communicate. This whole new email system is not for you. You will be always using pen and paper. And so I think we just have to evolve sort of how we think about these things and take the policy piece out of it and potential uses and really focus on here's the utility. And I think the other piece I would mention is we're focused really, I think, on international travel and COVID right now. International travel will continue beyond this. There are other use cases outside of COVID where vaccination is required, and that has always been the case. So I do think this has long-term longevity beyond the COVID pandemic. And then on the domestic side, you also have school requirements. And so I do think there's still a need to sort of modernize and use these types of systems so that parents are no longer having to go get that piece of paper, but they can in fact use these types of credentials instead. So those are what we're seeing. We're sort of stepping back and watching some of the policies play out. And we're hopeful that, as we kind of move through this, we're able to kind of, readjust and acclimate and hopefully move forward in a very thoughtful way.
Right. Thanks, Rebecca. Okay, I think we have time for one, maybe two more questions on our end. So the next question is, how do we ensure interoperability and security of vaccination and recovery certificates when factoring in the need for a validity period of such credentials? How long are certificates valid at the moment?
So I can share an answer from the context of the Smart Health Cards initiative. And the way that we conceive of these health cards is it's a certificate that we can give from a healthcare provider or a pharmacy or an immunization registry to a consumer that conveys their own clinical records. And so the fact that I received a COVID vaccination in the second week of May of 2021, that fact will always be true. And so from the perspective of what goes into that certificate, there's an issuance date that says when the certificate was created. And there's a clinical effective date for each dose of vaccine or each lab test that's described in there. So we try to do as faithful a job as we can of describing sort of the immutable truth of what happened in the world. We don't have a baked in concept of an expiration date on the certificate itself, because the aim is to give as much as we can a durable artifact to the consumer that they can keep and that they can use downstream. Now, it may turn out that my vaccination certificate from 2021 isn't going to buy me much next year or the year after, depending on what we learn and how the science evolves of COVID immunity and protections. So those are sort of clinical and policy questions. But as far as the technical artifact goes, we saw no reason for it to expire up front. And we thought the most flexible and transparent thing we could do for consumers was to give them a record that didn't proactively expire. Only if something goes wrong might they decide that it wasn't useful anymore.
I'd echo that and really say I think one of the things we've seen is verifiers saying, great, there's an artifact. How do we know whether, first, how do we find guidance on what conditions we should be setting? Should we have a guidance that says that in order to enter this particular country or to enter this particular workplace, how long should we consider a vaccination certificate valid? But that's quite independent from the sort of the technical standards or the credential itself. There is sort of a piece in the work that we've done around rules engines and how you can kind of automate some of the decision making around, does somebody meet the conditions of entry for a particular country or an airline? But again, that sort of layers on top of the credential itself. Like Josh said, the credential, it's sort of it's just the facts.
Great, thank you. And this is a related question. I think we've kind of provided some insight into this already, but I'm going to ask it again. So given that this virus continues to surprise us, are there any mechanisms to suspend a vaccination credential if the holder later develops a documented infection?
Yeah, so I think this does build on the previous question. And at least from the Smart Health Card's perspective, the idea is describe as much as we can the facts of the individual's history. And it's worth saying as little interpretation of those facts as possible, because we want the interpretation to be something that happens at the time a verifier goes to review in the context of a use case. And so, you could imagine different risk-based scenarios where different durations of time might be acceptable in different jurisdictions. Different vaccine products might be acceptable in different jurisdictions. That all gets to the kind of rules engine discussions that Dakota was describing. Just to give one really specific example of how this way of thinking goes down into our data model. We use the FHIR data standards for representing immunization history. And so, for example, when I say that I got a dose of a particular COVID vaccine on a particular date, there's a slot in the FHIR data model that lets you say something like, this was dose number 2, or this was dose number 1 of a sequence. But in our implementation guides, in our data profiles, we explicitly say, don't fill out that field, because you know what? That field could be wrong. Maybe we thought it was dose 2 of 2, but it turns out to be dose 2 of 3 because we've got a booster program now. Or we thought it was dose 2 of 2, but actually the person never received the first record. So instead, we focus on just communicating the facts that we know and as little interpretation as possible.
And just to add on to that, from I think the public health and that clinical side, we don't do this for any other vaccinations. It's true. These business rules are what are so important to really determine whether or not you need that. In practicality, we don't ever invalidate a vaccine. What we find is that there might be a booster dose that's needed. It doesn't invalidate the first doses you got. It just now builds on that. And so your clinical decision support that says, hey, you're recommended to receive this vaccine, and here's why, based upon the history we have and what we know. I think it's really important to remember that, because I think it sounds like we're trying to recreate something when in reality, we have this model that's been working for 30, 40 years. This is just a different type of flavor of vaccine and different flavor of disease.
Super valuable insights. Thanks, Rebecca. Thanks, Josh, for that. Okay, so that wraps it up for the first session of day 2 of our workshop. I am going to pass the mic over to Dr. Brian Anderson, who will moderate today's second session. Before I do so, though, I want to say a big thanks again to Rebecca, Dakota, and Josh for sharing this valuable information with all of us. So with that said, Brian, I'll turn it over to you.